Hi everybody, my name is Aline Dembekjian. I am going to be presenting on the patient Elsie today. So let's first off introduce the case study. My case study is about a 32-year-old female, her name is Elsie, who's admitted in the ICU for hantavirus pulmonary syndrome, valley fever, small bowel obstruction, and ascariasis. She also has a medical history of having type 1 diabetes. She's B12 deficient. In the past, she's been also diagnosed with Crohn's disease in her early 20s. Some of her past surgical procedures have been terminal ileal resection, approximately 70 centimeters, secondary to her Crohn's disease diagnosis in her early 20s. So the patient was admitted to the ICU because of epigastric pain, nausea, worsening vomit, abdominal distension, and recently was in a remote village in Mexico on an excursion for her treasure hunting. And so, upon developing stomach pain, nausea, and really sharp abdominal pain, she was admitted into like a village clinic there and developed hypotension and pulmonary edema, which is excess fluid in the lungs. Usually it's caused by heart conditions, which the hypotension kind of tips us off to realize that that's where it's coming from. So at that point, a nasogastric tube was placed for decompression to relieve like the abdominal pain and discomfort. And the total parenteral nutrition was also used due to the fact that she had limited capacity for her bowels to be able to absorb any of the nutrition at that point. So at a certain point when she was admitted into the ICU, they had done some CT scans to show that there was a small bowel obstruction, which is specifically in the distal jejunum and the wall thickening of the terminal ileum, which was where they were able to find the ascariasis, and that's associated directly to the bowel ischemia. And let's see here. So at that point, Elsie was brought into the operating room for a laparotomy, where approximately 100 centimeters of the proximal portion of the jejunum was found to be necrotic. At that point, they had removed that portion, and the entire duodenum was removed, measuring 22 centimeters. Some of her anthropometric data is that she is 175 centimeters. She is 53.6 kilograms. BMI is unusually low, around 17.4, which indicates a little bit of malnourishment. And some of her initial primary diagnosis upon entering the hospital was the hantavirus pulmonary syndrome, valley fever, small bowel obstruction, and ascariasis. And due to all of that, her secondary diagnosis was protein calorie malnutrition. So when the patient was first admitted, it was straight to the ICU where they didn't actually calculate her energy needs at that point. So that was calculated later on. We'll get there. But after the laparotomy, the enteral feedings began. So the patient was intubated, therefore considered ventilator dependent. And for that reason, her estimated caloric needs were based on the Penn State equation. That equation is to calculate her basal metabolic rate, which is the calories she's burning just at rest, even when she's just laying there. And so that is needed in order to find out how much nutrition is going to be fed in the tube feedings. So that equation is the Mifflin equation times 0.96 plus T max, which is the energy, like the thermal energy, times 167 plus VE times 31 minus 3085. So Her caloric energetic needs were 1,308.75 um, calories. So that's what she needs to meet every day in order to get sufficient nutrition. Her protein needs were looking like pretty normal. So that would come out to about 55 to 66 a day for her. And the fluid needs were 1 millimeter times the BMR. So let's see here. That would be about 40 grams per hour, which is considered the standard water flush. This is some of the patient's biochemical labs. So the labs looked pretty much normal except for the albumin level, the serum albumin levels of 1.8, which indicates a high risk of malnutrition. And that is due to the small bowel obstruction that she's currently experiencing. And the BMI is another indicator here. It looks like she's at 17.3, which also indicates that she's undergoing malnutrition. So those are kind of like the big indicators that she's not exactly balanced at the moment. So the enteral tube feeding formula is specifically designed for Elsie. She also has type 1 diabetes, and because of that reason, her ability to process glucose in her bloodstream is very, very limited. Not even limited. Sometimes she's unable to process the sugar because her pancreas shut down. So due to that fact, enteral feedings tend to have the tendency to promote hyperglycemia, which is elevated blood sugar levels. So it's important to make sure that this specific type 1 diabetes friendly formula is chosen for LC. So there are different brands that are chosen, but in this case, we can just specify it as DSF, which is Diabetes Special Formula. And that helps manage glucose levels just more efficiently and helps bring down the glucose that's unnecessarily given to people sometimes when they're given the tube feedings. So the PES statement for LC would be inadequate protein energy intake. The etiology coming from that would be the decreased ability to consume sufficient energy and or protein secondary to intubation. The signs and the symptoms would be the current estimated intake from diet less than recommended levels. The intervention would be enteral nutrition, the tube feedings, and the goal would be to meet estimated nutrient needs via the enteral feedings, specifically the diabetes-specific formula. And so the nutrition education for somebody like Elsie that's undergoing small bowel obstruction, a couple other things, type 1 diabetes, management of the healing of her gastrointestinal lining, would be, after such a surgery like that, would be to experiment with foods and add them in individually, one food at a time in small amounts. And if a certain food makes you feel worse, avoid it for now at least, because it's currently exacerbating the issue. So sometimes it takes time for things like this to heal, even though she was in the hospital for 1 month. Just the ability to stay curious and open-minded when it comes to trying certain foods so that you can find what really does fit. And if anything makes you feel worse and it lasts more than like a day or two, just to go back to the hospital, reach out to the dietitian, and to work super closely with the nutritionist a dietitian, I should say, in order to find out what the best option would be for them. Other than that, let's see here. This small bowel obstruction that Elsie is undergoing, it's a huge role in why she's malnourished, because the small intestine is an organ that plays one of the hugest roles in the absorption of nutrients. So when that gets blocked, the contents of the intestine are blocked and unable to pass freely. So food can get stuck, other things can get stuck, and that's what small bowel obstruction is. And some of the signs that Elsie presented in the very beginning before even being admitted were abdominal distension, abdominal pain, constipation, worsening nausea, and vomiting. And so the treatment for that is the NG tube that's passed through the stomach to relieve the distension that she was also experiencing. Other than that, thank you so much for listening to my presentation. If you have any questions, you can reach out at any time. Thank you so much for your time.